Namaste, I am Dr. G. Gangadharan, practicing in Bangalore. Today I am talking to you about a condition which millions of people are suffering from, rheumatoid arthritis or Vadarakta or Amavada as it is pronounced in Ayurveda. It's a chronic inflammatory condition with pain, swelling and inflammation in smaller and bigger joints. Rheumatoid arthritis, as per the modern science, is a autoimmune condition where body mistakenly disturbs or inflammates the bodily parts, which normally starts from small joints to the bigger joints. This is a disease which affects people who are having a delicate body type. We call it in Ayurveda Vata and Pitta kind of body type. Prayena Sugamaranam. Sugamara Sharira people are prone to get this disease. The causes of rheumatoid arthritis is many. There are environmental factors, there are genetic factors, but most predominant or most important factor is the diet. The people who are eating which are inflammatory in nature, which is not getting metabolized in the body due to many conditions of the body, intrinsic factors, accumulates a kind of ama or kind of a toxins in the joints, and this disease perpetuates in the body. Ayurveda treats rheumatoid arthritis with the medicines as a pacification treatment and also Shodhana Karma or Panchakarma as a long-term treatment. Vadarakta or rheumatoid arthritis need a long-term treatment because it is a disease which permeates from the body and comes when your stress level goes up, when your dietary changes, when the climate changes. There are three factors which increases or which reflects more in the body at different. Ayurveda treats this condition in stages. So first level we try to assimilate the bodily elements which are there by the body itself so that it slowly gets drains out. We call it as amapachana. Then the second level we try to strengthen the body tissues by giving nutritive elements which strengthen the body's joints. Third level is the stabilization of the body elements. So these three stages which will be culminated by a course of Panchakarma therapy, and normally we have 7 days, 14 days, 21 days treatment for chronic conditions. Initial conditions, sometimes even medicine alone with dietary changes will be sufficient. Depending upon the condition of the patient, this can be decided. There are many herbs that are being used in Ayurveda. Normally a multi-herbal therapy, where are more than 1 or 2 herbs are used as a yoga or combinations. So empty number of herbs which are being used in Ayurveda. There are many decoctions, really powders, gudigas, etc. are used. Some of them like Rasnayaranda Dikashayam for example, Kaishara Gulgulu, Vadiga for example. But these are all person specific. A doctor decides which of this has to be used. So the principle of treatment is if the toxic accumulation in the body is minimum, we will use pacification treatment where medicines with the dietary changes will be sufficient. If there is excess and chronic condition, we do apply Panchakarma, which can be one week treatment in house and be 2 weeks treatment. Normally we do a 3 years of treatment, 3 years, every year 14 days of treatment, and another 11 months that patient will be supported by that treatment that we undertaken by the patient. In chronic condition this is needed. And one of the important thing is that you have to very well follow the dietary principles given by the doctor. Why Pathya? People think that, oh, it is very difficult to follow Ayurveda, but it's not the case. If a very judiciously formulated Pathya can be enjoyable and can be liked by the patient. And the principle of Pathya in this condition is avoid deep fried items, avoid reheated food, avoid fermented food. These three are the food which is inflammatory in nature by its characteristics. So avoid that one. What you can take, normally things that you take at home like boiled vegetables, steamed vegetables, cooked items, rice, ragi, wheat and things, other vegetables which are generally used in our ecosystem. So there is no prohibition of that. But normally in this condition, we generally tend to avoid non-vegetarian items, especially red meat, which is basically inflammation. Otherwise, we advise in conditions like people who are non-vegetarian in nature, we can use kinds of soups of bone and brain soups, etc. advised. See, there are three outcomes we look at in the one is the improvement of the mobility, reduction of the pain, and no more swelling. Actually, in a chronic condition of rheumatoid arthritis, slowly the joints, cartilages degenerates and crumbles and dries up. And you can see deformity after some time on the fingers, people who are classical. And all the time you may not see RA positive or ACCP positive. There can be seronegative rheumatoid arthritis where there will be no blood, blood will not show any kind of the markers, but there is disease penetrating the body. So a physician should be able to understand this inflammation. This should not be mistaken by ordinary joint inflammations and gouty arthritis or osteoarthritis, which are specifically not full body affecting, whereas rheumatoid arthritis is the full body affecting condition which has to be taken very seriously. And one of the important things that we use in rheumatoid arthritis, oils. There are umpteen numbers of oils in Ayurveda. We use, if there is inflammation is more, one kind of oil, less inflammation, other kind of oil. There is pain with redness, there is another kind of oil. So we have got at least 40 to 45 formulations, oil only for external application. A good Vaidya should be able to select the appropriate one for that patient. That's why very often we say that Ayurveda treats the patient, not the disease. So disease, where it has inhabited, that place also we take into consideration when we treat. A combination of this food, medicine and Panchakarma treatment, this is the tripod on which Ayurveda treat rheumatoid arthritis.